Cervical spondylosis and cervical syndrome commonly affect middle-aged and elderly patients. Other disorders include irritation and compression of the cervical nerve roots, spinal cord, or vertebral arteries, which can produce a wide variety of symptoms. Thus, there is significant variation in both pathology and clinical presentation. Mild symptoms include headache or numbness of the arm and shoulder. More severe symptoms include limp, aching extremities, urinary and fecal incontinence, and paralysis. When the vertebral artery or sympathetic nerves are involved, dizziness, panic, and chest oppression may manifest. Twina is safe and free of side effects. It is a primary treatment for cervical spondylosis. Part 1. Cervical spine anatomy and physiology. The first cervical vertebra has no vertebral body or process. Due to its circular shape, it is called the atlas. The second cervical vertebra is called the axis. Its odontoid process extends from the vertebral body of the axis, forming a critical connection with the vertebral arch and the interior ligament of the atlas. The third cervical vertebra through the seventh cervical vertebra each have one vertebral body, one vertebral foramen, two vertebral arch pedicles, two vertebral arches, two transverse processes, two transverse foramen, four articular processes, and one spinous process. Misalignment of the spine's articular facets is a common problem. The spine has a wide range of motion. It can rotate as well as flex and extend forwards, backwards, and laterally. Rotation primarily occurs between the atlas and axis. The third to seventh cervical vertebrae are responsible for flexion, extension, and lateral flexion. There is a high incidence of injury to the cervical spine. Part 2. Disease causes. Neck problems have many different causes. 1. External head and neck injuries. 2. Chronic neck strain. Bad posture or long-term occupational stress can lead to chronic soft tissue injury, reducing spinal stability in the neck. This can accelerate spinal degeneration. Three. Cervical spine degeneration. Early cervical intervertebralis disc degeneration, reduced fluid in the vertebral pulp, and ruptures in fibrous rings may occur. Also, reduced flexibility, narrowed intervertebral space, dislocated or overlapping articular processes, and reduced vertebral stability may lead to fissures and osteogenesis in the small joints and degeneration or ossification of the ligaments. Blood vessels and nerves may receive direct or indirect pressure. 4. Other factors include neck and throat infection or congenital abnormalities. Part 3. Clinical presentation and classification. 1. Cervical type. In early stages, recurrent episodes of neck and back pain are common, with increasing severity of pain and stiffness that spreads from neck to shoulders, back and head. Difficult flexion, extension, and rotation may present, as well as dizziness or migraines. 2. Cervical spondylotic radiculopathy presents with sustained unilateral or bilateral radiating pain in the neck, shoulder, and arms. Other accompanying symptoms may include numbness in the fingers or paroxysmal severe pain, Heightened neck activity or abdominal pressure may aggravate the symptoms, and affected limbs and hand grip may weaken to the point that one or both hands may suddenly drop objects. 3. Arteriovertebralis cervical spondylosis presents with episodic vertigo, nausea and vomiting. Symptoms occur when the head turns or extends in a particular direction, and, if severe, may include falling, heavy-headedness, blurry vision, occasional darkening in both eyes, and numbness of the extremities. 4. Cervical spondylotic myelopathy. In the early stages, the patient may only feel a slight unusual sensation or notice nothing at all. Unilateral or bilateral pain, numbness, stiffness, or weakness may occur in the upper or lower limbs. Symptoms usually start in the lower extremities and spread upwards. Some patients experience chest oppression, girdle sensation, clumsy walking, or even quadriplegia or urinary and fecal incontinence. 5. Sympathetic cervical spondylosis presents with neck and occipital pain, migraine, dizziness, vertigo, tinnitus, heart palpitations, hyperesthesia, eye distension and throat discomfort. 6. Any situation with two or more clinical disorders is called a mixed disorder. Part 4. Twainer hand technique and methods. Section 1. Common hand techniques. 1. One-finger technique on the neck. With the patient sitting, the practitioner should stand behind and beside the patient. Hold the vertex in one hand. Keep the thumb of the other hand straight. Curl or relax the other 4 fingers. Open the tiger's mouth and put pressure on one side of the patient's cervical vertebrae with the pad of the thumb. The 4 fingers support the opposite side to provide stability. Relax the shoulder joint and upper extremities. Keep the shoulders and elbows low and let the wrist drop. Initiate movements from the wrist to move the forearm and the first metacarpal phalangeal joint. Vibrate horizontally or alternatively flex and extend the arm and elbow to apply alternating light and heavy pressure on the target area. In general, the movement frequencies should be 120 to 160 movements per minute. Focus the force on the tips of the fingers. Start from the nape and lateral side of the neck. Massage along the gallbladder channel and bladder channel on the shoulder and rub upwards. Place extra emphasis on gallbladder 20 and the cut-off area between the healthy and affected area. Work on the healthy side first, then the affected side. Key principles. A. Lower the shoulders. Relax the shoulder joints. Do not raise or tense up the shoulders. B. Drop the elbow. Relax the arm muscles. Drop the elbow naturally and make sure it is not externally rotated. C. Relax the wrist. Let the wrists hang naturally and avoid forced flexion. D. Keep the fingers firm and loosely extend the thumb. Firmly place the tip of the thumb on the target area. Avoid scraping or losing contact with the skin. E. Cup the hand and make an empty fist. Relax the palms and all fingers except the thumb. Don't drag. F. Tightly push and slowly shift. To tightly push means that the swinging movement of the wrist and the flexion and extension of the first metacarpal phalangeal joint needs to be rhythmic. To slowly shift means that the vibrating movement should be slow along the target area, using the thumb as a fulcrum. When working on the primary points that need longer treatment, No shifting is necessary. Looseness is the key principle of the movement. 2. Rolling of the neck, shoulder and back. Have the patient sit straight and stand behind the patient to the side. Hold the vertex with one hand and relax the opposite shoulder. Slightly bend the elbow to about 140 degrees, keeping the elbow 1 fist width away from your body, and contact the target area with your hypothenar eminence. Roll the back of your hand back and forth, keeping contact between your second and third metacarpals and the patient. Keep the wrist flexed about 80 degrees. Roll from the back of the hands to the sides of the fingers with your wrists at a 40-degree angle. Movement should be coordinated and rhythmic. The frequency of the rolling should be 120 to 160 rolls per minute. Work on the neck and shoulder area for about 5 minutes. Then, while rolling with one hand, use the other hand to apply passive range of motion in all directions. Key principles. A. Relax the shoulders and arms. Keep the elbow flexed about 120 to 140 degrees. Keep the wrist arched. B. Focus the force through your hypothenar eminence while rolling. Fix your hands on the area to reduce friction. C. Keep the range of rolling at about 120 degrees. Combine flexion and extension. Roll externally by extending the elbow to about 80 degrees. Extend the wrist and roll inward to about 40 degrees. Keep the pressure even, gentle and rhythmic. Roll continuously at a rate of 120 to 160 times per minute. 3. Plucking, pressing and kneading. Stand behind the patient, place one thumb on one side of the cervical spine and open the tiger's mouth. Pluck, press and knead from the medial to the lateral side of the neck. The plucking motion is as if plucking a string. Work on the area 1/2 to 1 swun above and below the affected area for about 1 minute. Make sure your hand technique is smooth and stable so that the force is transferred to a deeper level. Its effect is better if the patient has a sore and distended sensation. Then find Ashi points by palpating the superior medial angle of the scapula. Apply plucking, pressing and kneading techniques for about 1 minute. 4. Grasping, GB21 and the neck. With the patient sitting straight, the practitioner stands behind the patient. Grasp the shoulders on both sides with all your fingers. Focus on the line between DU14 and the acromial process, especially gallbladder 21. It's better if the patient has a sore and distended sensation. Then hold the vertex with one hand and grasp the neck with the other hand to lift up the skin and subcutaneous tissue. Extend all the fingers. Pinch the muscle with your finger pads. Grasp, lift and then let go. Do this from the top of the neck down continuously. Gradually increase the force, then gradually decrease it. Repeat at least 3 rounds. 5. Neck rotation. Support the chin of the patient with one hand and hold the back of the head with the other hand. Rotate the neck in both directions 5 to 7 times each. This movement should be gentle and slow, and the range of motion should increase gradually. Avoid vigorous movements. 6. Neck manipulation. A. Lateral tilt manipulation. Stand behind the patient. After applying the neck rotation technique, turn the neck to one side until you feel resistance. Then apply sudden but controlled manipulation towards the opposite side. This can usually increase the range of motion for rotation by 3 to 5 degrees. A clicking sound is usually heard, and this means that the resetting of the vertebrae is successful. One must not overly force the movement. The manipulation should be light and quick, and not just about achieving the clicking sound. One should be very cautious when applying this technique because it is not site-specific. This is a commonly used hand technique in China, but laws on administering manipulation techniques vary from country to country. B. Cervical fix manipulation. First type. With the patient sitting, rotate their heads towards the affected site as far as possible. In this case, we are using the right side as an example. Place your left thumb on the right side of the spinous process of the affected vertebrae. Support the neck with the other 4 fingers. Hold the chin with the other palm and grab the mandible. Pull the jaw upwards towards the affected side so that the head is slightly anterior rotated to the healthy side. Stop when your left thumb can sense the shifting of the spinous process. Then apply a sudden traction and pull towards the posterior right side with your right hand. At the same time, press the spinous process forward or laterally with the left thumb. You can hear a clicking sound and will feel the shift underneath your left thumb. Second type. Stand to the side behind the patient and press the transverse process of the affected vertebrae with the left head 20 to 40 degrees. Then move it to the left about 30 to 50 degrees. Stop when you feel a shift underneath your thumb. Keep pressing the transverse process with your left thumb, then place the other 4 fingers on the temple of the patient and press the head down to the left. The right hand comes underneath the chin to grasp the head and raise the chin up at an angle, while rotating the neck slightly along its anteposterior axis. The head is thus rotated and raised to the limit of the range of motion, where a sensation of resistance may be felt. Then, both hands apply coordinated force to rotate the neck 3 to 5 degrees in a controlled manner. This movement will often create an audible clicking sound, and the practitioner may simultaneously feel a gliding sensation of the spinal process underneath the left thumb. Key principles. A. Your hand technique should be light, even, coordinated and unforced. B. First, extend and rotate to assess the patient's flexibility. When you find resistance, add a sudden bit of force and then stop. The movement must not exceed normal physical limits. C. In the process of manipulation, you can usually hear a popping sound. Many people will think this indicates a successful manipulation. However, it is not necessary, and one should not inappropriately force the popping sound because severe injury may result. D. Use extreme caution when applying this technique. Section 2. Modifications based on patterns. 1. Treatments of cervical type. Protocol. Common hand techniques. Key points: press and knead muscle spasms and local points. A. Neck and shoulder one-finger technique. Work on the healthy side first, then the affected side. B. roll the neck and shoulders to fully relax the muscles in spasm. C. Plucking, pressing and kneading the neck muscles. The key is in pressing and kneading the spasmodic muscles and plucking the ropey tissues. D. Grasping GB21 and the neck. E. Lateral manipulation. Two. Treatments for cervical spondylotic radiculopathy. Protocol. Use common hand techniques plus pressing and kneading of small intestine 11, pressing points on the arms, rolling the arms and rubbing and shaking the arms. A. Use the one-finger scrubbing on the neck. B. Grasp the neck and shoulders. C. Roll the shoulders and neck. D. Rotate the neck. E. Site-specific manipulation of the neck. For cervical spondylotic radiculopathy, add the following hand techniques in addition to the common techniques. A. Press and knead small intestine 11. It is more effective to produce a sore and distended sensation. Advise the patient to frequently and gently move their neck to maximize alleviation. B. Roll the arms. Practitioner stands on the lateral side of the patient, supports the arm on the affected side and applies rolling techniques from top to bottom for 3 to 5 minutes. Place emphasis on the areas innervated by the affected nerve. C. Press and knead points on the upper extremities. Press and knead large intestine 11. Press and knead large intestine 10. Press and knead San Jiao 5. Press and knead large intestine 4. Press and knead the point Luo Jian. D. Rub and shake the arms and pull the 5 fingers. Rapidly squeeze the shoulder with both palms and slowly move down the arm to the wrist. Do this 3 times. Then apply traction and slightly but rapidly shake the arm. Make sure the vibration reaches the shoulder for about 1 minute. At the end of the treatment, squeeze the patient's fingers with the knuckles of your index and middle fingers. Then pull the fingers. You can often hear a popping sound. 3. Treatments for arteriovertebralis cervical spondylosis. Protocol. As a general rule, do not apply shaking or manipulation to the neck. Add the techniques of opening the heavenly gate, rubbing the Kangong area, massaging around the eyes, taiyang point and ears, and grasping the neck. A. Use the thumb to rhythmically press the neck. B. Use the rolling technique on the neck, shoulders and upper back. C. Pluck and knead the sinews on the back of the neck. D. Grasp gallbladder 21, the neck and upper back. E. Open the heavenly gate. With the patient seated, use both thumbs to massage the forehead upwards from the point yin tong towards the point du 24 for 1 minute. Your hand technique should be soft, relatively fast and gentle. F. Rub the Kangong area. Your thumbs should begin together, rubbing laterally from the point yin tang towards the point tai yang. Repeat for 1 minute. G. Press on the taiyang point simultaneously. Apply gentle pressure in a circular direction for 1 minute. H. Massage around the eyes. Stand to the side of the patient and then use your thenar eminence to create rhythmic chuffing around the orbital region. Your hand should not directly contact the eyes and pressure should be mild. Circle the area around the eyes for 1 minute. I. Knead the helix of the ear. Using your thumb and fingers, gently knead the helix of the ear, covering both the anterior and the posterior sides. This technique should be done for about 30 seconds, or until the patient's ears become reddish or they experience a warm sensation. J. Brushing the temples. Gently and quickly brush the thumbs against the temples, moving along the hairline towards the ears. Your hand should move rhythmically with the other 4 fingers of each hand slightly curved to lend support. Apply this technique for 30 seconds. K. Grasp the 5 channels of the head with the 5 fingers of your hand. Start with your middle finger on the Du channel and move from anterior to posterior. L. Apply site-specific manipulation. 4. Treatments for cervical spondylotic myelopathy. Protocol. Refrain from using manipulation or shaking techniques. Add rolling and grasping of the extremities and stretching of the neck. A. Use the thumb to rhythmically press the neck. B. Use the rolling technique on the neck, shoulders and upper back. C. Grasp the neck and the region around gallbladder 21. D. Roll the arms. With one palm resting on the patient's arm, use the other hand to roll up and down the arms 3 times. E. Grasping the arms. With one palm on the patient's arm, use the other hand to grasp the muscles of the arm, moving distally to cover the arm 3 times. F. Roll the legs. With the patient lying face down, use the rolling technique on the back of the legs, covering from top to bottom 3 times. G. Grasp the legs with the patient lying face down. Use both hands to grasp the muscles of the legs. Work 3 times from top to bottom. H. Stretch the neck. Stand next to the patient and place one hand on the lower jaw and the other hand on the occiput. Gently stretch the neck forward and backward. The movement should be slow and relaxed, and shaking and manipulation methods should not be used. 5. Treatments for sympathetic cervical spondylosis. Protocol. Do not apply shaking techniques. Add opening the heavenly gate. Rub the Kangong area, Taiyang points, and the area around the eyes. Massage the helix of the ear, brush the temples, grasp the 5 channels, rub the back, massage the back transporting points, rub the chest and rib sides, and stroke down the SCM muscle. A. Use the thumb to rhythmically press the neck. B. Use the rolling technique on the neck, shoulders and upper back. C. Grasp the neck and the region around gallbladder 21. D. Pluck and knead the neck and shoulder area. E. Open the heavenly gate. F. Rub the Kangong area. G. Rub the point Taiyang. H. Chuff the area around the eyes. I. Massage the helix of the ears. J. Brush the temples. K. Grasp the 5 channels. L. Apply cervical manipulation. M. Rub the back. Stand to the side of the patient and rub down the bladder channel of the back for 2 to 3 minutes until the patient feels penetration. N. Massage the back transport points. First, massage the lung transport points. Then, massage the heart transport points. Massage the diaphragm transport points. Massage the San Jiao transport points. O. Horizontally chuff the chest and rib side from the midline outward using your palms. Start from the subclavicular area and work your way down, stopping at the level of the 12th rib. Do this for 2 to 3 minutes to create enough heat to penetrate the skin. Do not hold your breath. P. Push down on the Qiao Gong point. Push down along the SCM muscle using your thumb pads to cover the area 20 times. Repeat for the other side. Don't work on both sides of the Qiao Gong point at the same time. Part 5. Cautions. 1. X-ray should be examined carefully before treatment to make sure that cervical tuberculosis or tumours are not present. 2. Tuina hand methods must be even, gentle, deep, and not overly aggressive. 3. Pulling methods should be carefully controlled. To prevent accidents, one should not pull too hard. 4. Neck pulling and shaking is prohibited in the case of cervical spondylotic myelopathy. 5. Combining Tuina with traction, acupuncture and physiotherapy will improve results. 6. To prevent neck injury, don't bend your head or raise your shoulders for too long. Also, try not to carry heavy objects or sleep with pillows that are excessively elevated. 7. Instruct the patient in appropriate neck exercises like neck flexion, extension and rotation. This will support the cervical muscles, enhance local circulation and prevent the recurrence of cervical spondylosis. Let's now do a self-test. Test 1. Please say the names of the following methods aloud. The correct answer is 1. Cervical fixed manipulation type 2. 2. One finger technique on cervical area. 3. Cervical fixed manipulation type 1. 4. Plucking, pressing and kneading. 5. Rolling of the upper extremities. 6. Grasping the neck. Test 2. Which is the protocol for arteriovertebralis cervical spondylosis? The correct answer is number 5. Use common hand techniques, exclude neck rotation, add opening the heavenly gate, pushing the kangong, rubbing around the eyes, pressing the taiyang points, kneading the ears, rhythmic brushing of the temples, and grasping the 5 channels. Test 3. Which 2 common Tuina hand methods for neck disorders are missing from the following list? The missing methods were grasping the Jianjing, GB21 and neck, and cervical manipulation. Did you get it right? Cervical spondylosis and cervical syndrome commonly affect middle-aged and elderly patients. Other disorders include irritation and compression of the cervical nerve roots, spinal cord, or vertebral arteries, which can produce a wide variety of symptoms. Thus, there is significant variation in both pathology and clinical presentation. Mild symptoms include headache or numbness of the arm and shoulder. More severe symptoms include limp, aching extremities, urinary and fecal incontinence, and paralysis. When the vertebral artery or sympathetic nerves are involved, dizziness, panic, and chest oppression may manifest. Tuina is safe and free of side effects. It is a primary treatment for cervical spondylosis. Part 1. Cervical spine anatomy and physiology. The first cervical vertebra has no vertebral body or process. Due to its circular shape, it is called the atlas. The second cervical vertebra is called the axis. Its odontoid process extends from the vertebral body of the axis, forming a critical connection with the vertebral arch and the interior ligament of the atlas. The third cervical vertebra through the seventh cervical vertebra each have one vertebral body, one vertebral foramen, two chronic neck strain. Bad posture or long-term occupational stress can lead to chronic soft tissue injury, reducing spinal stability in the neck. This can accelerate spinal degeneration. Three, cervical spine degeneration. Early cervical intervertebralis disc generation, reduced fluid in the vertebral pulp, and ruptures in fibrous rings may occur. Also, reduced flexibility, narrowed intervertebral space, dislocated or overlapping articular processes, and reduced vertebral stability may lead to fissures and osteogenesis in the small joints and degeneration or ossification of the ligaments. Blood vessels and nerves may receive direct or indirect pressure. 4. Other factors include neck and throat infection or congenital abnormalities. Part 3. Clinical presentation and classification. 1. Cervical type. In early stages, recurrent episodes of neck and back pain are common, with increasing severity of pain and stiffness that spreads from neck to shoulders, back and head. Difficult flexion, extension, and rotation may present, as well as dizziness or migraines. 2. Cervical spondylotic radiculopathy presents with sustained unilateral or bilateral radiating pain in the neck, shoulder, and arms. Other accompanying symptoms may include numbness in the fingers or paroxysmal severe pain. Heightened neck activity or abdominal pressure may aggravate the symptoms, and 2 vertebral arch pedicles, 2 vertebral arches, 2 transverse processes, 2 transverse foramen, 4 articular processes, and 1 spinous process. Misalignment of the spine's articular facets is a common problem. The spine has a wide range of motion. It can rotate as well as flex and extend forwards, backwards, and laterally. Rotation primarily occurs between the atlas and axis. The 3rd to 7th cervical vertebrae are responsible for flexion, extension, and lateral flexion. There is a high incidence of injury to the cervical spine. Part 2. Disease causes. Neck problems have many different causes. 1. External head and neck injuries.